In this video, we're going to talk about how to get patient contact or healthcare experience without a certification. This is kind of a remake of my older video, and that video, as I recall, has very poor sound quality. My mic stopped working at the start of that video, in fact. And so this is kind of like a remake of that video, and it'll just be in a higher quality in terms of audio and video. And so let's just get started. It's just very crucial information for pre-PA students. So this is basically how you get patient care, healthcare experience without a certification. When you are in high school or when you are in college, you really want to get into the low end jobs in hospitals, like a food service worker or anything that doesn't have a barrier to entry. And like a food service worker will be a relatively low barrier of entry, right? And so once you get that job, any sort of job that just gets your feet wet in a hospital, you stay there for 6 months. And then what you do is you level up after 6 months. You get a position that doesn't require certification and that's more hands-on. So a sensible way to think about this is like a more hands-on experience or a more healthcare oriented job. That would be patient transporting. So 6 months in the food service department and then another 6 months in the patient transport. Now, patient transport job is a really high quality job in my opinion because that's what I did. I got to see everything because I transported patients from different floors, from the ER to CT scan, the ER to MRI, from surgery like to the progressive care unit, like everywhere. And so I got to know a lot of the healthcare system in that job. And it just solidified like the knowledge of what like a hospital does and how the system works and how the people are in different departments and the jobs of peoples in different departments. And so I really like that job. And I did that in my junior year of college, which is really late. And so that's why I'm trying to also give you tips on when to really start this. So I would, if I had to start this patient transport experience, I would start it like really early college or even late high school because it does not require a certification. It probably just requires a high school diploma and you being 18 years old. And so late high school in your senior year and or freshman year of college. That's the most sensible way to go about this. The next thing I would do is also, we are not going to do certifications because that was my problem, that I couldn't get a certification because of my lack of understanding at that time, which will I get into the end of the video. I would like to take a quick break and introduce myself personally. My name is Harsh Patel and I'm a pre-physician assistant student. I am involved in making self-improvement, health and fitness content, but also giving out advice on how to be an effective pre-physician assistant student. If you like my content, please hit the subscribe button because I really want to reach 100 subscribers before the end of this year. I promise that I will be of great value. If you have any questions, please comment on my videos and I will be engaging. I guarantee that I will help you out. And so the next thing I would do is get a nursing assistant job. Now, nursing assistant job is probably the number one job that you can do for pre-PA school. Number one job you can do for your application cycle and your overall resume if you're applying to PA schools. Because that job is really patient oriented. You will be one of the key members in the nursing department. You will take care of patients very holistically because I feel like nursing assistants spend the most amount of time with the patients or have the ability to spend the most amount of time with patients. And that is the ultimate patient experience job that you want. So the best job that you can have in this 3-tier list is a nursing assistant job that in many places even in my local hospital, it didn't require certification. And so that's a plus. And so you can do that throughout your undergrad. Now, yes, if you want to be fancy, and if you want to like level up your game, you also want to really go for jobs that are more than nursing assistant, because it would just add on to your knowledge of the healthcare system. And so I would apply to pharmacy tech jobs. Those sometimes are non-certification jobs too. Sometimes ER techs are non-certified, which is fine because you will have a bachelor's degree, right? So I am currently in my gap year, and so I am doing this process of becoming a pharmacy tech, and that does not require a certification. And so that's a positive benefit for me. And so this is how you go about on getting patient care experience without certification. So just let me tell you about my little journey. So all throughout college, or all throughout high school, I wanted to be a doctor. I wanted to be a medical doctor in the United States. And then in some research that I did and people that I talked to at that time really encouraged me to become a PA for my own personal reasons. And I also shadowed a PA in my college when I was in my college. And that really just motivated me to become a physician assistant. But I did not have any patient care experience until junior year of college. You can argue that patient transport is not a patient care experience, but it depends on the schools you're applying to. It definitely does come under healthcare experience. Every school that I've looked at has differing amounts of requirements about healthcare experience, patient care experience. There is a distinction between healthcare and patient care. I would say that patient transport job is much more of a healthcare than a patient care experience, but it depends on school, honestly. And so my first healthcare job was patient care or patient transporting. And my second healthcare job was nursing assistant, which is also a patient care experience. And that is rated, even if you do research, it's probably the number one patient care job for PA schools. And so I did not get my full experience until at the end of last year, basically in 2022. I was really late, and then I applied last year, and I'm still waiting to hear back from schools. And just this is an update. I'm still waiting to hear back from 5 schools that I applied. And for the other 5 schools that gotten back to me, it's not looking that good from those other 5 schools. But I still have 5 more chances. And so I'm keeping my hopes high, getting my patient care hours in. Hopefully, if you are watching this video and you are in the middle of this journey, good luck to you, and catch you in the next one.